Okay. Hello, everybody. My name is Stephen Jacob, and I'm with the College of Medicine, and I will be leading today's case with the concern on false identification. I'll be joined with my fellow colleagues today, Brennan Osler and Harshal Dudia, who are part of the College of Pharmacy, as well as Presley Bayer and Kelsey Livick, who are also part of the College of Nursing. Next. So before we start, I kind of wanted to bring a case overview of what this is about. So we have a 22-year-old undocumented Hispanic migrant worker by the name of Marcella. She is 24 weeks pregnant and suffers an emergency where she basically had a stack of pipes that fell on her at work at a factory. And because of such, she came into the office or the emergency department with concern of complications with her pregnancy. Of course, a prenatal screening for various tests were done, and she was found to be positive for COVID. But this is not a simple case of undocumented migrant worker coming in for healthcare. The case itself is a little bit more complicated than that. Marcella has a cousin named Maria who is a legal U.S. resident, and she is using her name and cousin's identity so that she can work and receive prenatal and other healthcare benefits within the United States under her cousin's electronic health record and legal identity notification here, while her cousin is away in California on vacation. So because of such, there's a lot of medical implications in terms of how to properly go about caring for Marcella's prenatal case. Number one, the fact that she's using her cousin's biological data as listed in Maria's own medical record, and this information is not identical to that of Marcella. In addition to what makes this case more complicated is that Marcella herself is RH factor is negative. However, because she's using her cousin's medical records, it states that Maria's RH blood factor was positive. Marcella also needs RhoGAM to prevent problems for any future pregnancies, and this data is also needed to clear in an event of emergency requiring blood transfusion, such as a postpartum hemorrhage or more specifically hemolytic anemia. And because of such, this also brings into question and concerns about what's appropriate to prescribe and how we can legally document this. In addition to this, there's ethical implications of which Marcella intends to complete a workers' compensation forms for healthcare coverage under her cousin's name, and how this could be qualified as insurance fraud. Also, nurse overhearing Marcella planning to continue work despite promising to self-isolate due to her COVID positive status because she may not feel like she can afford such. So a lot of different ethical considerations to look forward to. And Kelsey, who's part of the College of Nursing, will be able to talk about more on the scope of practice. So next.
Hi, I'm Kelsey. I'm covering what the scope of practice is for each professional named in this case. First, the nurses, doctors, and other healthcare professionals seeing Marcella for the first time in an emergency room setting are required by law to screen and treat Marcella for any emergency services, regardless of her immigration status or ability to pay. This is because there was something enacted called the Emergency Medical Treatment and Active Labor Act, which will help Marcella cover her healthcare expenses through Medicare and or Medicaid. So this is what she should be informed of by an appointed case manager. Then once Marcella is ready for discharge, she should be assigned a caseworker who can advise her to go to a federally qualified community health center or a migrant health center. They're essentially the same sort of entity, except for that a migrant health center will focus on seasonal workers and farm workers, whether or not they're documented. And it just depends on what's available in her area, and that's where she can go for her prenatal care. She will then be able to pay on a sliding scale regardless of her immigration or insurance status, and her nurse can reiterate this as well after she hears it from her case manager. To the left is an example of a posting of the law just to inform immigrants and people coming into the emergency room of their rights. So what role does an interprofessional team have in engaging Maria? We covered that a little bit already, but the interprofessional team should let Maria, who's really Marcella, know that they have a duty and a desire to serve her and her unborn child, regardless of her immigration status. They should also inform her that using her cousin's identity could have a negative impact on her health, her cousin's immigration status, and have future legal implications for everyone involved. This includes fees that range from a couple $1,000 to $10,000 and or prison time. So it's really serious, and it could affect could affect the healthcare team, it could affect her cousin, could affect Maricela herself. So it's important to let her know what the legal implications are. But that should be done, I think, gently, because otherwise it will discourage her from seeking help when she needs it. So she should know her options and know that she has the ability to maintain her own identity and still be covered under the US healthcare policy. And just going into detail about EMTALA, or the Emergency Medical Treatment and Active Labor Act. This is a law that was enacted by Congress in 1986 under what's called the Consolidated Omnibus Budget Reconciliation Act of 1985, which is also known as COBRA. This law protects unstable patients without insurance or a means to pay for their health care from being dumped by a US healthcare facility that participates in the Medicare program. The law defines an emergency as a condition that could be expected to put the health care of an individual in serious jeopardy, could cause serious impairment to bodily functions, or could cause an organ to be impaired. It requires hospitals that receive compensation from Medicare to provide patients with an emergency healthcare screening and to include ancillary services available to the ER to determine if an emergency actually exists. Medicaid might also help to cover the costs for emergent healthcare services, but this is state dependent, and the scope of services offered through this program varies by state. So it's important to know what your state laws are. So for example, in New York, chemo and radiation are covered through this. That's considered an emergency service. And outpatient dialysis is covered in California and North Carolina. Those are just two examples of how the states can vary in their scope of practice and coverage. Even if Maricela does not qualify for EMTALA or Medicaid, it's possible that she could still be covered by what's called the patchwork system of safety net providers in the US. This includes public and nonprofit hospitals, federally qualified community health centers, which goes by the abbreviation FQHCs, and migrant health centers. FQHCs and migrant health centers receive funding from the Federal Health Resources and Services Administration, or HRSA, and are required to serve vulnerable populations regardless of their ability to pay, immigration, or insurance status. They offer services on a sliding fee scale. Migrant health centers are distinguished from FQHCs, as I mentioned before, by the fact that they only serve migrant and seasonal farm workers and their families. Also, if a hospital has a large percentage of low income and or uninsured patients, the hospital can be recognized as a disproportionate share hospital, or DSH, by Medicaid and Medicare. Being recognized as a DSH helps the hospital receive additional funding to help cover the costs of uncompensated care. All right, I'm going to pass this on. I think it's Brennan.
Yes. So what is the responsibility of a healthcare provider when they learn of insurance fraud? Well, first, let's talk about what insurance fraud is. It occurs when one lies or misrepresents facts, such as one's identity, in order to obtain an improper payment from an insurer. Insurance fraud is a serious problem in our country. According to the FBI, the total cost of insurance fraud is estimated to be more than 40 billion per year. And this means that insurance fraud costs the average US family between 400 and 700 per year in the form of increased premiums. Now, in this case, Maricela would be committing insurance fraud by filing for workers' compensation. Now, Maricela can't actually get workers' compensation because she doesn't technically work at the factory. Now, allegedly, she plans to file for workers' compensation under Maria's name, which is the name she's been working under. And so if she does this, then she would be committing insurance fraud because obviously she is not Maria. So according to the Texas Department of Insurance, if you know or suspect that someone has committed insurance fraud, Texas law requires you to report it within 30 days. Now, that phrase right there is not exclusive to healthcare providers. That includes anyone at all who knew or suspected this possible insurance fraud. In this scenario, it's not clear exactly if the healthcare team knew about her plan to file for workers' comp, but if they did know, then they would have an obligation to report that, and they can be penalized for not doing so. Honestly, anyone involved in this scenario, Maricela, the employer, the factory, the medical staff, and anyone at all who knew or knows that Maricela is planning to basically commit insurance fraud here can be held accountable if they do not report it. All right, and I'm going to pass it on to Stephen now, I think, next.
Thank you, Brennan. So what is the legal implications of prescribing ROGAM and narcotic prescription in this case? And I think this ties back to what Harshal and Brennan also are going to stress later on too. It's based on the conflicting or idea of falsifying information on the patient assuming identity of another due to legal documentation concerns. In Marcela's case, who's posing as Maria, if she does not come clean about her documentation status and protocol for prescribing ROGAM and narcotics without notification of the treatment team, or if that's not made known between the pharmacist and the healthcare team that is seeing the patient at large, this could result in legal penalties on the medical healthcare team overall in terms of treating Maria. The number one thing is there are inconsistencies in the patient record due to two different individuals sharing one identity under a health record system, which asks for inaccuracies in providing treatment and can impact overall care in both Maricela and her cousin for future pregnancy terms if Maria decides to have more children. So the legal concern in this case is not simply opting to treat Marcela, but the fact that she's also assuming the identity of another legal citizen to gain access to care, and by extension, the appropriate need to prescribe specific medications is in conflict with the contraindications of the assumed patient identity. According to the AMA Journal of Ethics, they state that it is the physician and by extension the healthcare team to treat the patients who are in life-threatening or high-risk circumstances regardless of documentation status within certain parameters. However, if any criminal act is performed, in this case the falsification information of Marcela, assuming the guise of her cousin, during the process of providing care, those actions itself must be reported to the appropriate authorities if made known by the healthcare providers themselves. The providers are at risk for falsifying patient identity on the health record and prescribing said medication when it is not indicated according to the assumed identity, and thus makes the need for a possible separate electronic health record for Maricela herself clarified altogether. In this case, also, the pharmacist responsibility it is the duty of the pharmacist itself and the responsibility of them to contact the Board of Pharmacy or the DEA to report false identity if that identification is made known, and otherwise malpractice charges both on a state and federal level could be made on this basis if that is not reported in of itself. And so how does this information change your treatment plan and recommendations? That will be done by Presley from the College of Nursing, and she will take it away from you.
How does this information change your treatment plan and recommendations? So communicating to all members of the healthcare team involved in Maricela's care about her documentation situation and her assuming the identity of her cousin for prenatal care reasons. A conversation with the patient to get the full picture on her needs and concerns need to be clarified and addressed. Information from case management and social work about EMTALA to cover expenses for Medicare and or Medicaid provided to the patient. Planning with case management to get Maricela set up with the sliding scale pay, irrespective of immigration insurance status. Her new patient record can be made separately without writing orders for prescriptions under a false identity. Reporting COVID positive screening to the state board. Communicating with Maricela's existing family in the U.S. that the patient wishes to have involved during this care to make a consensus on the process of care during pregnancy and post-birth.
Howdy, everyone. This is Harshal, and I would like to go in depth about public health implications. So although the United States have firm life-saving policies in hospitals, such as resuscitating the patient regardless of economic status, there are certain immigration policies in place that prevents undocumented immigrants from access to emergency services, as well as indirectly discourage them from seeking additional care. And furthermore, undocumented immigrants will be less likely to seek further advanced care because of fear of deportation, criminalization, separation from the family, or even arrest. So because of that reason, there is hesitancy on behalf of them in terms of seeking additional healthcare services. And those strict immigration policies have been associated with poor mental health outcomes among the immigrants, as well as igniting burning desire for substance abuse in order to combat that stress. And that is one reason why there's vertical transmission of the stress, which means it'll be passing on from the undocumented migrant workers to their children, who ultimately experience PTSD, malnourishment, hypertension, low birth weight, autism, and other calamities. And all these circumstances not only affects one particular ethnicity, but also the entire public. And to kind of tie it up with our case of Maricela, the way it affects the public is since Maricela is COVID positive, the healthcare providers must be aware of their appearance and to sort of not make it intimidating on her by subjecting her to legal grounds. Instead, they should kindly proceed on interviewing her and getting further information from her. And it's even better on Maricela if the healthcare provider is speaking second language, such as Spanish, if Maricela does happen to be a native Spanish speaker, in order to sort of alleviate that language barrier. And because of this, Maricela is less likely to make spontaneous decisions that can have a negative impact upon the public's health. So we need to stop that from happening. Otherwise, it places public health in jeopardy if Maricela chooses not to remain in quarantine after finding out about her COVID positive and going out in public to seek further employment in order to provide for her incoming baby or her current family. And this exposes general public to COVID and makes it even harder for epidemiologists to contain the virus, since she's not even going to be into the system because of her documentation status. They're not going to be able to pinpoint the source of it. So that's why if Maricela does end up infecting someone with a weakened immune system, then it can potentially lead to death. So it is quintessential for healthcare providers to maintain that compassionate attitude toward her and be kind in their approach to her. And I will pass it on to the next person.
So to summarize some of the points you made today, it is required by law to treat Maricela whether she is a legal citizen or not. The healthcare team has a duty to provide care for Maricela and her unborn child. We agree that it is in the best interest of the patient, her unborn child, and Maria to inform Maricela of the legal implications of posing as a different identity. The medical team can refer her to case management to help her get connected with the best resources for her care, as well as make a separate health record to prevent any potential medical errors in the future. The healthcare team should also consider educating the patient about COVID-19 and how to safely quarantine and prevent others from contracting the virus, as well as the importance of doing such. And then these are our references that we use for this presentation.